Is slapped cheek syndrome contagious to adults? When it comes to slapped cheek syndrome, many people wonder if it can affect adults. This condition, also known as fifth disease, is caused by the parvovirus B19. While it is primarily seen in children, adults can indeed become infected. The illness is characterized by a bright red rash on the cheeks, which looks like a slap, hence the name. So, is slapped cheek syndrome contagious to adults? Yes, it is. The virus spreads through respiratory secretions like saliva, mucus, or nasal discharge. This means that when an infected person coughs or sneezes, they can pass the virus to others nearby. Adults who have not been previously exposed to parvovirus B19 are at risk of catching the infection from children or other infected individuals. Interestingly, adults may not show the same symptoms as children. While children often develop the classic slapped cheek rash, adults typically experience different symptoms. Commonly, adults may have joint pain and swelling, especially in areas like the hands, wrists, knees, and ankles. These symptoms can mimic arthritis and may last for several weeks or even months. The contagious period for the virus is particularly important to note. The virus is most contagious during the early phase of infection, before the rash appears. Once the rash develops, the person is usually no longer contagious. This means adults can catch the virus from children who are still in the early stages of infection, even before any rash is visible. For adults, especially those who work with children or have close contact with infected individuals, there is a risk of contracting the virus. To help prevent the spread of slapped cheek syndrome, practicing good hygiene is essential. This includes frequent hand washing and avoiding close contact with anyone who is showing symptoms during the contagious phase. In conclusion, slapped cheek syndrome is indeed contagious to adults. They can acquire the infection through respiratory droplets from infected children or others. It is crucial for adults to be aware of the different symptoms they might experience, primarily joint pain instead of the classic rash. Understanding these aspects can help manage exposure risks, especially in environments where children are present. If you suspect you have been exposed or are experiencing symptoms, it is always best to consult a healthcare professional for proper diagnosis and management.